Freeman is a very typical community health system. We have 3 acute care hospitals, total beds around 400, very fast-paced environment. We do very high volumes, lots and lots of people in our clinics. I was approached by one of our hospitalists about a communication tool between physicians and nurses. We're really just trying to make their job as easy as we can make it. Less time standing at the computer doing things, quicker and more efficient communication between the nurses, physicians, and the other care providers. In the end, we chose Mobile Heartbeat because of the capabilities, the vision that we saw, not only ours, but Mobile Heartbeat's vision as well.
I really like using the app. It's easier to be able to communicate between all of the people on the same medical team.
Before, when we were taking a report from other nurses, it's, well, what extension are you at? I've got Post-its everywhere. Now it's like, well, what is your name? Now I can just look them up because I know that they're on medical or they're on TCU.
We've seen a big difference in the workflow. Now we're able to reach the physicians at a faster pace than before, and we're able to see who exactly is a part of that patient's care team.
If I go into a patient's room and they need to go to the restroom or something like that, then I can just pull up my phone and text that tech that's taking care of that patient.
We tend to make things ours here at Freeman. We have vendor partnerships that we've formed and we do co-development projects. But the thing that attracted us to Mobile Heartbeat specifically was the openness of the platform. What we envisioned right away was, could we implant other products in with the Mobile Heartbeat tools? We very quickly figured out the tech part of it. We have added other applications easily reach from the Mobile Heartbeat platform.
The launch points that we have are very helpful. For instance, the Nova Vigilance and Micromedics.
Our rounding tool is actually on the app, and I don't have to push a cart around, to go into room to room. And I can look up IV compatibility. That's just right there and easy to use.
I really like to be able to look at the labs before I come in or before I go and see the patient. Then I like having access to them if they ask me a question on something I hadn't looked up.
The lab values that we get every morning, if they are not within a normal range, then I get a buzz on my phone to let me know that I need to be looking at something into my patients. Hey, do you have a good connection on the lead set? So it not only acts as a backup to my busy schedule, but it also protects the patient safety-wise as well.
It allowed us to give physician tools as part of the Mobile Heartbeat, nursing tools. Mobile Heartbeat supported us in our efforts to do that, and it's resulted in us having a tool that served a lot of folks, but yet was personalized toward the audience as well.
Communication is everything. So much better than what we had before.
I think it's cut down on a lot of the communication errors that would take place during the day.
I don't have to call up the operator and say, hey, I need to call a code at this phone. I can do it from my phone, and everyone's going to be in contact of what's going on without having a lag.
I have everything right here. I can look at my patients. I can look at labs if I need to. I think our time management is going to be way better now.
We're all extremely happy with the Mobile Heartbeat, the selection, the implementation, and I think it will ultimately result in better patient care because they can spend more time with the patients.